As usual, present at EuroPD is Gambro. For many years, this company is active in the field of PD, but it senses a different mood at this year's gathering.
Well, when I looked at the program in advance, I was very impressed. I thought this is going to be a great meeting, as usual. But right now, in the middle of the meeting, I must say I'm a little bit depressed by the message. I think we focused a lot on all the marginal groups of patients and how PD can be used for them, the old and the frail and the diabetic patients. And I see PD as an excellent therapy for the young and the fit patients who want independence. And so far, we haven't talked very much about that.
Gambro presented the results of a survey among physicians. It shows there's a gap between saying and doing when it comes to PD.
We see a big difference in what people say about PD. They all like PD, they all promote PD, they say, but then in actual fact, they prescribe it and use it to a very limited extent. And we've seen that same happen in many examples shown at this meeting. And I'm wondering if we shouldn't focus more on what we can do to turn the opinion towards PD, not against PD. We need to join forces and help, but the industry is always accused of having commercial motives behind what we do, and therefore I think the nephrologists are the ones who will move ahead.
The number of PD treatments is in decline at the moment, and there have not been any major innovations in the PD field lately. However, Gambro still sees a future for PD.
I think possibly that we should consolidate and try to increase the patient number instead of spending resources on new products. We have quite excellent, not just we, but the whole world of PD is provided with quite excellent products as it is today.
Gambro says it will stay in the PD field and is now focusing on markets with a growth potential. The company is working on some new PD innovations, but of course does not reveal any details yet.